In focus now, Congresswoman Nancy Mace, South Carolina Republican, member of the House Oversight and Veterans Affairs Committees. We are happy to have her in focus today. Thank you, Congresswoman. So first of all, let's just start with what the president should be saying this afternoon.
Well, for starters, he should not attack the American people. He needs to provide reassurances to our country that we'll have testing available. I am very keen on the idea of expanding testing and having the federal government provide tests to the American people. I'm worried about the number and the amount we're already seeing in the Northeast. Testing sites being overrun and people waiting hours just to get the test. But that's a good step in the right direction, I would say. But we need to provide assurances to the American people, to the governors, to states that are dealing with Omicron, and will in the next few weeks as it makes its way through our country, on how we're going to handle that. And that's everything from testing to the availability of vaccinations to the availability of PPE, and making sure that the American people have the right information. And rather than attacking, we want to make sure there's growing trust, not distrust of the government, growing trust in the medical community and doctors rather than sowing the seeds of distrust. That's the kind of message we should be looking for, and I hope to hear this afternoon.
Look, real quickly, and then we'll move to the next thing. You're with your voters in South Carolina. You're talking and listening to people. What has been something that this White House misstepped on the most with regard to COVID? Because we now have more people dying. We have less access to testing. I mean, it's in some ways we've gone backwards.
Right. It's been a lot of I think the misinformation, sometimes misleading information, also the vax mandates. There's enormous pushback in my community in the state of South Carolina to allow people, families, businesses to make these decisions. These are decisions that really should be made at the state, local, and then personal level. There's been enormous pushback here on those mandates, and the attacking people who are vaccinated or not vaccinated. It goes both ways, but attacking others during this time. This is not, COVID is not solely in the United States. It's everywhere around the world.
True.
And we really, truly have to work together. It's been politicized. We continue to politicize it. And that's, I think, made getting through this thing even tougher. And Omicron is going to be more prevalent than ever. It sounds like it's less deadly.
As far as we know.
There are there's more breakthrough cases, though, with Omicron, too. And we want to make sure people have the right information so they can make the best decisions for themselves.
So you just mentioned something that is so important. It's everywhere. It's not just in the United States. So I haven't heard the president or his team at the White House taking down the unvaxxed in countries where they don't have access to the vaccines. I mean, if you want an even playing field, wouldn't they be, according to the White House, the enemies, if you will, and with regard to COVID? I do want to get to this
for sure.
from Congressman Andy Biggs of the great state of Arizona, because we're on this topic. And here's what he tweeted in terms of his response. This is sick. Biden and his crew want to fearmonger their way into dictating your private health care decisions. We're not falling for it. Congresswoman, your reaction.
Well, I would agree. And I think the vast majority of Americans would agree, too. These kinds of mandates scaring people, especially during the holidays, Christmas and New Year's, to bully them into this is not the way to go. We need to not be attacking the American people. We need to provide reassurances. We need to give them hope, give them information and data to make good decisions for themselves and their communities, and give states the ability to manage the hot spots, obviously the Northeast, where there's more metropolitan areas right now.
Yes.
And it's going to make its way through the country. And so we need to make sure that there are reassurances to all of our governors across the country that the federal government will provide access to testing that they need, PPE, et cetera, when this thing hits the fan everywhere else in the country. So that's what we need to be hearing from everybody across the board today.
Yeah, you talk about readiness. I mean, you're waging readiness, less fight among each other with these politicians and more readiness, and that takes leadership. I want to get to this. Look, a lot of parents are really concerned that they're going to start putting kids back in virtual, and we know the educational harm and emotional challenges that can bring for a lot of kids. Washington Examiner op-ed reads this way: any state, city, or school district that is closing down schools and forcing children back into the catastrophe that is remote learning is ignoring 22 months of data. They are sacrificing children's education on behalf of the panicked segment of the population that is afraid to go outside without a mask on. No one is being protected by shutting down schools and mandating that children be vaccinated, masked, or constantly tested. What's your reaction to that, Congresswoman Mace?
I can tell you, I've seen it firsthand, the struggles of virtual learning and how awful it has been for our family and how my
Hmm.
children, own children have struggled. So I've seen the struggle firsthand. We don't want to see the federal government do blanket lockdowns or anything to that nature. It really should be up to parents on how their kids go to school, not up to anybody else. I can tell you, I've already had a conversation with my kids who during Delta variant, I sent them to school in masks. I've got one kid that's still wearing a mask. I've got one kid that will take it off behind my back. But I've already told him, I said, when Omicron gets to South Carolina again, and
Hmm.
we have a prevalence of this variant, you're going to school in KN95 masks because those offer greater protection than surgical masks or medical masks. So that they can be protected. I'm already having these conversations with my kids. I
Hmm.
don't want to see them in virtual learning. I do want to keep them healthy. We're talking about washing hands again. We're doing all the things that we need to be doing and limiting big events and those sorts of things. We're making those steps and making those decisions, and we're
Yeah.
able to, as parents, we should have the ability to do that for ourselves and our kids.
So what you're talking about is just having the choice to get your household ready to send to school rather than somebody
Yeah,
shutting it down and forcing you to become the teacher again. You would be
exactly.
much more equipped than I. It was a struggle. Science was hard the first time
Yeah.
than this time around. Good to
Algebra
see
kills
you.
me. I can't even. Thank you so much.
Congresswoman Mace, we appreciate your time and your expertise today.